This is the thyroid gland. Usually, if a patient comes to you and you put your thumb on the patient's right side and your index finger on the patient's left side of the larynx here, that is the neck, just under the Adam's apple, and you tell the patient to, hey, swallow, please. Then what happens is the thyroid gland here, it goes up and down because of some muscles. And if the thyroid is swollen, then you will be able to palpate it. So that is how you palpate. You can even try on your own body. Try to palpate your thyroid gland. If you see you're able to palpate, then please go to the physician because you will need an ultrasound to do. And ideally, you should not be able to palpate that, okay? So this is where thyroid gland is, here in the neck, at the base of the neck. Behind the thyroid gland wraps around the larynx and the esophagus over here. Behind it, you will find 4 tiny glands. These are called parathyroid glands. Now, both are very, very important, and any problem with these glands can be life-threatening. So please remember the names: thyroid here, parathyroid at the back behind the thyroid gland. So what does the thyroid do? It is one of the largest glands, and you've seen the salts, and everyone knows that on the TV also they used to show that you need iodine for your body. That's because of the thyroid gland, because the iodine, whether it's 3 or 4 of them molecules, they bind with the thyrine to form the T3, which is the triiodothyronine, or the tetra, which is also called the thyroxine. Now, thyroxine is the final product, or the T4, that circulates in our body and goes to each cells. Over there, they're again turned back to T3 and the actions happen. Now, what are the actions? The actions are mainly metabolism and growth. But in the process of metabolism and growth, there will be multiple actions. For example, if anyone's thyroid hormone is not functioning properly, or if it's hyperfunctioning, does not matter. It's just the opposite action. Then it may cause decreased menstrual cycles. If it's hypo, that is decreased, or there will be heavy bleeding of menstrual cycles if it is hyper, that is increased thyroid hormone. Similarly, there can be a lot of anxiety and stress. If there is a hyper, that is increased. If there is a hypo, then there will be a depression. Muscular, there can be muscular weakness in either hyper or hypo. In both situations, there will be muscular weakness. Whenever there is a patient come in with a very high heart rate, we check a few hormones. Obviously, first thing we do is make sure that the heart is okay. We do the EKG. Next, we order the lab for the TSH and the thyroid hormone, because the thyroid hormone increases the heart rate, whereas decreased thyroid hormone can cause decreased heart rate. Similarly, in the gastrointestinal tract, it can cause constipation. If you have decreased thyroid hormone, it can cause diarrhea if you have increased thyroid hormone. Less thyroid hormone, the metabolism is low, so you will feel cold in hypo, and there will be like dried skin, whereas in hyperthyroid, there is increased thyroid hormone, there will be wet and warm skin. Okay, so you sometimes, I don't know if you've experienced, but if you shake hands with some people, their hands will be very sweaty and warm. So there's a high possibility that their thyroid hormone is high. So now, like I said, when you read chapters or when you do questions, I want you to think that these are your patients. You are in the clinic, you're seeing the patients, and you need to figure out, okay, what is the diagnosis and what do I need to do? Okay, so this patient, I've already said the diagnosis here, but still try to imagine. A patient comes to you and says, oh, I've had a lot of weight loss over the last few months. I've been eating a lot. I'm being so hungry. I'm eating a lot, but still I'm losing weight. I'm feeling nervous. I've been having palpitations. When I go to bed, I can feel my heartbeat. It's so high. And then I feel like flush. I have warm, sweaty hands. And then the first thing you notice is the patient has an enlarged gland at the neck. Now, it might not be so much enlarged. This enlargement is called goiter, but maybe there is a mild enlargement over here, maybe that will be visible. And you also see that the patient's eyes are sort of protruded. So now you realize, okay, what is happening? The patient's thyroid hormone is increased, and therefore all these symptoms are there. Now, the gland, obviously, to produce more hormones, the gland increases in size, the cells are increasing in size, it's producing more hormone. And this increase in thyroid hormone, along with some autoimmune aspects, what happens is there's inflammation behind the eyes, the soft tissues of the eyes, and the muscles of the eyes. Those get like inflamed and swollen. It's called edema, okay? Some inflammation and swelling, that's called edema. There is swelling in the soft tissue and the muscles, and the eyes get protruded. And believe me, this is not a very good situation. And I will tell you a case of mine that the patient has to suffer a lot. But this is a diagnosis of hyperthyroidism. Now, next, totally opposite. A patient comes in with puffy face, as you can see in this picture, a puffy face. The eyelids, the lower eyelids are puffy here, and the face also seems a little puffy. And the patient says, "I've been very depressed. I don't know, without any specific reason. I feel depressed. I've been having crying spells without any reason, and I've been having a lot of hair fall, constipation. My menstrual cycles are not good. I'm not having menstrual cycles for 2-3 months, and I feel dry and cold." And then you order for the test of the TSH, that is the thyroid stimulating hormone, and the T3, T4, and you figure out that the patient has decreased thyroid hormone, that is the hypothyroidism. Now, so these are the opposite scenarios. Now, in babies, infants, when they're born without much thyroid hormone, that can call something called cretinism, and it can cause mental retardation and decreased growth. Okay, so thyroid hormone is really, really, really important. Now, let me tell you a quick scenario. In my case, one of the patients, she came to me with this these symptoms, and she had exophthalmos, which is the protrusion of the eyes, and hyperthyroidism. And then the surgeon did a surgery and removed the thyroid gland. Now, when they removed the thyroid gland, I had told you before that the parathyroid glands are behind this. Okay, you see here. So after the thyroid gland was removed, the patient started having hypo, that is decreased calcium. And so much of decreased calcium that that the patient was having spasms of muscles, weakness, fainting, tetany, and was hospitalized due to weakness on all these things. So she was after that given lots of calcium supplement, injectable calciums, and high dose of thyroid, obviously, because the thyroid gland was removed. So you have to remember that thyroid gland behind it has the parathyroid gland, which helps with the calcium. So thyroid and parathyroid are very much related. So when one gland is removed, that is for the thyroid, you have to look into the calcium, how the calcium is doing. Now, this is an interesting hormone called calcitonin. The way parathyroid hormone helps increase the calcium in the blood, the calcitonin helps decrease the calcium in the blood. And where is this found? Now remember, calcitonin is not found in the parathyroid. It is found in thyroid glands. So these are the follicles, and these follicles within the gland, you'll find this. These are the colloids where the thyroid hormones is there. And then between the follicles, these glands are called follicles. Between the follicles, you'll find these cells. These are the parafollicular cells, so the C cells producing calcitonin. And I'll talk about that real quick. But here is the parathyroid gland producing more, increasing the calcium level of the blood. And these are the functions of the parathyroid. How does it increase calcium? First of all, it removes calcium from the bones. So when there is excessive parathyroid hormones, people have osteoporosis. Okay, weak bones. There's a pores in the bones. Osteo is bones. Pores in the bones is osteoporosis. So what the parathyroid usually does is increases the blood level of calcium by removing calcium from the bones. Next is it prevents calcium loss from the kidneys. Again, increases the calcium in the blood, and it activates the vitamin D, and that itself increases calcium absorption from the gut. Now, one interesting thing I want to tell you, okay, vitamin D is actually not a vitamin. Okay, this is a very interesting thing, and you can use this to quiz someone in your family or friends. But vitamin D is actually considered a hormone and not a vitamin. It is a misnomer, though it's called a vitamin, but it is not like vitamin C, A, B, because vitamins are not produced in our body. Vitamins are got from outside, from food and supplements and everything. But vitamin D is not got from outside. it is produced in our body through sunlight. In the skin, there is change from one form to the other, and then in the kidneys, the next part. So that's an interesting question, and I liked it myself when I was in med school. So you can use this as a quiz question for others. So now you see calcitonin. Let's come back to calcitonin. The way parathyroid hormone, that is PTH, was increasing calcium, calcitonin decreases calcium in the exact opposite ways. It puts calcium back to the bones. It inhibits or prohibits the calcium from the kidneys to be reabsorbed, and it prevents calcium to be absorbed from the intestines. So these are two counteracting hormones, though calcitonin is not that strong as parathyroid hormones. So definitely don't expect that if there is a high amount of parathyroid hormone, calcitonin will counteract. No, you will have to take care of that with the help of surgeries and other things. So now, quick question. A physician diagnoses a patient with iodine deficiency. Which of the following observations most likely help the physician with this diagnosis? So let's solve it together because we don't have too much time. So decreased production of functional thyroxine. Now, if you think, okay, iodine deficiency, what will it cause? Obviously, I told you that 3 iodine molecules forms a T3. So I think first option is the best option, but you have to read all the 3 options before answering. So does it decrease both the TSH and the thyroxine? No, because when the thyroxine is high or low, the TSH acts opposite. You remember Dr. Bonita Halda told you about the president, when the citizens give some feedback, the president changes the module. So that's what happens when there is high amount of thyroxine in the body, then the hypothalamus and the pituitary starts decreasing the production of TSH. So when there is decreased iodine, there will be increase in the thyroid hormone, but decrease in the thyroid hormone, but increase in the TSH. So it's opposite. Same here, the decrease in the TSH is the wrong answer, and an abundance of glucose in the blood is totally not the right answer, because though it does affect the glucose with some metabolism, but the main glucose activating or increasing or decreasing hormone is the insulin. So the answer is decreased production of functional thyroxine. Another quick question, and this is an easy one. I don't have to solve it with you. You know the answer already. Increased synthetic activity of parathyroid hormone will lead to, so parathyroid increases the calcium in the blood. It increases production from or release from the bones. It increases absorption from the kidneys, or it increases reabsorption from the kidneys and absorption from the intestine. So the answer is an increase in the renal calcium reabsorption. Which of the hormones thyroid gland makes? It does not make TSH. It does not make aldosterone. Definitely not parathyroid hormone or parathormone. It makes the calcitonin. Okay. Now let's go to the pancreas real quick, and in 5 minutes, just giving you an idea about the pancreas. It is the very, very important gland in our body. If your pancreas is not working properly, you may die without any insulin supplement in a few days. It's that dangerous, okay? So pancreas, it is an exocrine and endocrine gland. It produces some digestive fluids which cause digestion in the gut, and it produces endocrine hormones like insulin and glucagon. Now remember, if you take a part of it and see it in the microscope here, this is called the pancreatic islet, okay? It's called islet of Langerhans, or simply islet. And these are the other glands which produce the digestive enzyme, goes through the duct into the intestine. So this is the islet of Langerhans. The islet has the beta cells and the alpha cells. Now remember, beta is B and insulin. So I remember by the word binsulin, okay? So binsulin is B, insulin, beta, insulin. So beta cells release insulin, so the other cell releases, that is the alpha cell releases glucagon. Now also you have to remember an important thing: what increases and what decreases the glucose level in the blood. Since glucagon has the name glue in its or the letters glue in the name, glucagon increases glucose in the body, whereas insulin inhibits glucose in the blood, okay? So just remember, glucagon, we are talking about the blood only. Don't get confused. Glucose increase in the blood by glucagon because it has glue in it, and insulin inhibits glucose in the blood. Okay, so insulin inhibit glucagon, glucose in the blood. So that's how you will be able to react quickly. If a patient is there in your clinic, you will be able to react quickly. Okay, there's high amount of glucose in the blood, so the glucagon is high or the insulin is less. So now about this I already gave you a rough idea that the insulin is triggered from the pancreas when there is glucose or glucose in the blood after you eat food, and then the glucose, when the insulin puts them back into the liver and the muscles, they change into glycogen, that is a polymer of the sugar, and they are also changed into the glycogen is stored in the muscle and the liver, whereas the glucagon does the exact opposite. It breaks down the glycogen to glucose and from the liver and muscles and puts it into the blood. Now, a patient comes to you and the patient has said that, oh, he's now at this point like vomiting a lot, nausea, vomiting, and severe abdominal pain. And you have like he went directly to the restroom again to vomit and came back. He is very, very sick. And you don't have much time to ask, but whatever you ask, the patient said, oh, the last few months I've been having excessive urination, but very thirsty. I've been drinking lots of water, have been feeling to eat a lot, but I've been gaining some weight. Actually, some patients even lose weight, but it differs. But this is the history, and the patient is now in a severe condition, and you check the glucose and in the clinic, and it says HI, high. So it is so high that you can't even measure. It doesn't even give you a value for the glucose. No, what you do, you call 911, send the patient immediately to the hospital because the patient was having diabetes mellitus for a long time, but did not go anywhere for treatment. And now the patient is in a condition called DKA, which is diabetic ketoacidosis, okay? Now that is a severe condition where the patient can even die. Okay, so that is what I was telling you. Glucose is insulin is so important that it can kill a person. And before ending up with the pancreas or the endocrine system, let me tell you once more or reiterate once more, endocrine system is one of the most important things or most important systems in our body. Like Dr. Bonita Haldar said, it is like the movie director. Without the movie director, you cannot have a good movie. So here, without the endocrine system, the heart, the kidneys, the lungs, nothing can work properly. The brain, nothing can work. The reproductive system, everything will go havoc. Nothing will work properly. So give endocrine system a lot of importance because they will have a lot of questions in all the competitive exams. And there are other systems as well. I'll come back to the questions later. But there are other systems like the pancreas, the ovary, pineal gland, thymus, adrenal gland, etc., which I don't think I'll be able to cover today. But obviously, we will have lots more lectures in future. Destruction of beta cells of the pancreas would cause what? Okay, the beta cells, I told you already, beta cells is insulin. So beta insulin, insulin inhibits the glucose in the blood. So insulin secretion to stop and increase blood glucose concentration. Okay. Now, the next thing is, which of the following hormones would be expected to increase if you are studying for the test, skip breakfast and lunch? So you have fasting, your blood glucose is low in your blood and the blood needs more glucose. So what increases the glucose? Glucagon. Okay, I've already told you that. Now, there are some other things that we will have to study in future with our consecutive lectures. There's the chemical structures of the hormones and the classification of the hormones. There are steroid hormones and other hormones. So please read these well, start solving some questions, join us for the next lecture. And I wish you all the best for your future endeavor. I'm sure you all will turn out to be good doctors, nurses, pharmacists, dentists, and whatever medical career you want to go with. Thank you so much.